Welcome to the Hope Unlocked podcast. I'm Kristen Kurtz, your host. I pray this episode is like a holy IV of hope for your soul. Please help me welcome Mallory Kurkosky to the show. I'm so excited to have her here today. We actually have been chatting quite a bit before we got started, and I was like, you know what? I think we need to hit record because we have a lot of goodness that's going to be shared here today. So, before we do that, would you be open to sharing a little bit about yourself before we get into your story?
Yeah. So a little bit about me. I'm a mom of two. I have a 6-year-old and a 3-year-old. I homeschool them. Started that a couple years ago, which I love. I love doing that.
Oh,
And never thought that that was even a possibility. So that was one of those life moments that it was like a sharp left.
yeah.
And at the time, my husband was like, "Wait, what?" And I'm like, "I think," but it all like came together so beautifully, just schedules and like I think this is what it could look like. That it was obvious that the Lord was leading us to do that. So I enjoy that. But I've been a mental health therapist for about 10 years now. And as part in that, I've been a registered play therapist. So I've seen kids as young as 3 years old, but I've also, gone up to adults in their 60s. So I'm not necessarily limited by age. And so I became known more for kids and teens just because it's not very common um,
Yeah.
for RPTs. And so that became a lot of my referral sources and stuff. And then I would end up seeing maybe their parents. And so I would see adults and do family work and things. So I supervise as well other play therapists because I love being able to help. I feel like I can impact more kids, more families, more
Mm.
clients through leading others so that they have their client list,
Pass
and
torch.
pass it on and then they can, help others versus me trying to feel like I'm having to take on all of the
Yeah.
clients. So I also teach a class at Bethel University, Intro to Play Therapy as part of their play therapy certificate.
Wow.
That's just in the fall that I
Okay.
do. And so I'm yeah in the midst of transition when it comes to starting my own consulting business in mental health and helping like businesses and workplaces and
Okay.
starting a nonprofit that works with survivors of trafficking. So it's
Mhm.
kind of a long list, but don't let that fool you. I'm not doing all of it at once. Like I feel like
That's good.
it's kind of like ebbed and flowed and
Yeah.
it's just, part of it. And I
Yeah.
think when people can hear the list of like, oh wow, she does so much. How do you do it all? It's like I don't do it all. It's it's definitely the Lord leading me and seasons like change throughout to be able to help me manage all of it. But yeah.
Well, I would love to. I've never heard of a registered play therapist
Yeah.
before. So, for those who are like me, who are like, what is a registered play therapist? Like, sign me up.
Yes.
I
Yes, so registered
tell
play
us more about
therapist,
it.
yeah, is a there's criteria and requirements that you have to, it's like a certificate. So you
Okay.
have to be a licensed mental health like professional, you have to be licensed with the board and then you have to complete all of the training and the supervision and requirements for play therapy specifically. And the training and education is vast. Like there is a lot. But they say, if you do 500 hours and, 35 supervision hours, they have all the requirements listed. Here's the education. Then you can
Mm.
become a registered play therapist, which really shows. So for anyone who would be looking for like, I need a therapist for my kid, if you
Right.
see the letters at the end that say RPT, you know for sure they have had the education. They have had like the standards are high with the
Mm.
treatment that you would be able to get. There are other therapists who are like, I work with kids. And then
Yeah.
it's like, yes, but are you doing so ethically? And you're not really doing play therapy. You can be harmful to the child if you really don't know what you're doing exactly. And that's not everyone who's not an RPT. There are some
Sure.
really good people, but
Mhm.
it is something like the RPT just like guarantees like that is, the high fidelity. That's the like there was a standard that was set so that it
Okay.
wasn't just anyone could see kids. It was just like, no, if you have this, then you've done the work and the supervision and you know what to do. So I
Okay.
did that along the training when I was getting my licensure hours for my LPCC, licensed professional clinical counselor is my license. And so
Okay.
I was doing them in tandem so that when I got licensed, I could apply for that. And make
Oh,
sure
wow.
that I have those credentials, and then became an RPTS, which is the RPT supervisor, so that I could supervise other people who are wanting to get their RPT so that they
Wow.
could have
It's
just
amazing.
really, it's just like better care for kids
Okay.
because
Okay.
they really kind of get the short end of the stick in the therapy world sometimes.
Mhm. So what would that look like? Because, I'm hearing like play therapist. What is a play therapist? What do you actually do with the
Yeah,
children?
so there are a lot of different evidence-based modalities. And so it's been around for quite some time. I mean, really even it can go way back into like early 1900s. And so people have developed these modalities and then have done research on it. So there's like play and non-directive play therapy and child-centered play therapy and experiential play therapy. I mean, so there's a long list of all these different interventions. So you do have to know what you're going to practice. Like, what is your scope? Because I can't be trained in all of them. So I would say I'm a child-centered play therapist and I like to do experiential. I've been trained in TheraPlay, but that's not necessarily my modality. So if you ask a therapist, like, oh, you work with kids, what do you practice? That also would be pretty telling because they should be able to tell you, this is what,
Mhm.
these are the methods that I like to use. This is what I want to do. If they can't really name any, then it's like, are you really doing it? Like, I
Right.
don't think you are,
Right.
which is not great. So
Yeah.
yes, so it is like evidence-based, like specific theories, specific interventions, and you really have to know
Mhm.
what you're looking for. You have to know how to recognize play themes from a child, what they're
Mhm.
playing out. Are they healthy? Are they non-healthy? If they're not healthy, like what are we processing here? And I can't ever say like, oh, you're playing with a dinosaur, so that equals this. But I can notice themes of aggression. I can notice themes of death or loss, and I can help them process through that. But it's important to know just the education around it because it does sound like you just play. Like,
Yeah, I was like, that sounds really
what?
good.
Like, yeah, I paid a lot of money to just play with them.
Right.
And so it does come off that way. Or when a kid leaves and the parents like, what'd you do? And they're like, we did Legos and we did some art and
Yeah.
it's
But
kind of
there's
like, what
a
are you paying for? Like
yeah.
so you got to know I talked to my supervisees, like you got to know the why. You got to know the background. You need to know the importance of just you're co-regulating with the child to keep them in their window of tolerance so that they can actually process the trauma that they have been through. So them playing in your office is not going to look the same as them playing at home. Because at home you got to do your parenting thing of like we're not going to shoot guns at each other and all the rules and things like that. But in my office, you can kill me. And you can shoot the guns because that is a theme and that is something, especially if you've witnessed violence or if because kids play out the
Yeah.
things that they've experienced and that's
Wow.
how they communicate. And so there's really no rules in the play therapy office. And so it's just allowing them to have a safe, contained space. Then you can leave it and you leave, which is similar to
Wow.
adults. We're asking you to just, process, leave it here and
Yeah.
leave. And so kids are able to do that well, which is why it's important to have someone who really knows what they're doing,
Yeah.
because it can be harmful if you kind of take it where it's like, well, it's not that big of a deal. Kids don't really notice because they absolutely notice,
Yeah.
and they do. It does impact them whether they say it or not. They may not know it on a conscious level, but they do. They can feel it. So
Yeah. Okay.
yeah.
That's
So there's a
amazing.
there's a lot to it.
Wow. Well, what led you down this path?
Well, it's a loaded question. So
I
I would
know. I
say,
know.
I know.
I love
Yes.
those questions.
Oh, yes. Okay. Well, I've been through a lot of trauma myself and as a teenager, specifically, it started when I was 12 and my brother died when I was 12 and he died in a car accident suddenly and then after that there was a string of just a lot of loss, a lot of change. I'm from Arkansas, so moving up here was in the midst of a lot of that stuff. So, um, there was just a lot.
Yeah.
And at the time, let's see, I think I started therapy when I was probably like 15 or so, but I
Wow.
was super resistant to it at first. A lot of bias because being in the South, going to therapy, like there was a lot of like you have to be like you're the crazy one, like that's it's
Oh,
like I'm
really?
doing
Yeah.
that. Yeah, so there's a lot of stigma with it. So I pushed back on it. Um, but when I eventually committed, which was not until we moved up here and was like, I do need help because I was in a dark place, a very angry place,
Mhm.
that therapy started to like help me and was working. And there was still a lot of chaos going on, a lot of family stuff happening, but it was still helping me. And so I could tell a difference. So
Mhm.
fast forward, college, I still didn't know what I wanted to do. I went to U of M,
Okay.
then took a couple years off after that, and then started to feel the Lord prompt me and like go back to school and becoming a therapist. Because I knew that I wanted to work with kids, just didn't necessarily know
You knew
what
that your whole
that.
life.
Yeah, of
What you
like
said.
I not necessarily my whole life, but probably as I probably in college started to be like I because I went for child psychology.
Oh, you
Well,
did. Okay.
yeah, so it's like I want to help kids because I went through so much. Therapy was helpful and it is really needed. Like we really need people to know what they're doing when it comes to working with teens and
Yeah.
working with kids. And you can totally change the trajectory of a person's life. If we can work on healing now, we're preventing personality disorders and some pretty significant mental health issues if we can get to it
Mhm. Mhm.
sooner, the better. So I knew like I wanted to do that, and then Bethel had a program that had some kids classes, play therapy classes in it, and then I was hooked. I was like, this is it just made sense. It just clicked for me, and I had a professor tell me they're like, you really get it. Not everybody does. Like there's a lot of people who really grapple with like is play therapy really working? And I get where sometimes it doesn't feel like it, but I've also seen it do some pretty amazing things.
Yeah.
Or when I can ask a parent, did this happen? And they're like, yeah, how did you know that? It's like because they played it out and this is, I can just kind of figure it out.
Yeah.
And so it really is incredible. So since like then it was just like I know that I wanted to work with kids. I know I wanted to work with teens and I knew that I if I had had someone sooner
Yeah.
when I was 12, student, like I know that it would have, like, who really knew what they were doing. Because the first one,
Yeah.
it wasn't. And I was tricked into it. It's like, that's not a great start. That's not how you want to start anyway
Right.
in therapy when you are
Right.
tricked into it, right? So,
Mm. So
um,
don't do that, parents. Just
yeah, don't do that. Don't do that. I know it feels like we got to get help. We got to get them help. But like, the only way therapy works is if it is reciprocate like the client has to do the work and I love working with teens. I think partly because I like to be sarcastic and so I
like
like to
your
joke with
kid.
them and
Yeah.
yes I like to do that and I can be a little snarkier but I can still hold them like validate them and hold them to the line of like validation and change. It's balancing those two things.
Mhm.
And they tend to like me. And so I enjoy working,
You're very
Mm.
likable.
Thank you. Thank
Yeah.
you. And I would lead a group and stuff and I would see them change and I would see them use skills and move away from suicidal ideation and self-harm and these things that, they're grappling with at 13, 14, 15 of pretty serious issues. And then now they're using skills and are doing better in school and making friends and stuff that it's a pretty awesome thing to be a part of.
Would you be willing to share, like, I'm just thinking if there's a parent listening in right now that, one of their, teens is really struggling right now, but is refusing
Mm.
anything. Like, what would you say to them?
I would say the parent can get help themselves because
That's good.
we
Hmm.
really minimize and underestimate the impact that our responses as a parent has on our kids that you can't force your kid to get help, but you can get help. So one that models to them like, well, I'm going to get help because I need it. Like this is a lot, whether that's learning. So now you've modeled to them because I often like it's been here, you fix my teen and they are the
That a
parent
lot?
is refusing, yeah, their own help. And it's just like, but I'm with them 45 minutes a week. You're with them all the rest of the time. And I think a lot of parents try to they're trying their best and trying to respond, but sometimes we need to learn other methods. Sometimes we need to learn what validation really is because we can get that confused where it's like, well, I don't want to approve of what they're doing. Well, that's not validation. So we need to learn how to hold our teens' emotions and our kids' emotions. And if I can't hold my own, I'm not going to hold theirs. If I
Mhm.
like think about your own emotions, you having a hard day, and if you have someone that comes up to you and just wants to talk about their hard day, more often than not, we tense up or we're just like, I can't do this
Yeah.
right now. Like, right, like we can't do that. And so
Yeah.
many of us as adults are just living in this place of like no room for anything else. And so when our kids and our teens are not doing what we want them to do and they're having their big emotions, it can be either triggering, it can trigger us from our own childhood. It can, we parent how we were parented.
Hmm.
So if my parents didn't do a great job. So unless I actively do something different, which I had to do, then
Yes.
that's how it's going to change. Like that's how I'm actually going to be able to make change versus the kid needing to make the change and the teenager needing to make the change. Because so often I have had to help kids and teens just survive the environment and teach them skills, knowing that they're not going to get better until they're either out of the house or the parents actually make the changes.
Um,
And then it actually gives the parent also some empowerment of like, it's okay to ask for help and you need it because this is really hard to navigate and parent in our culture right now.
yeah.
And we don't have all the answers. And if like there's things that you want to change, like that's okay. And that makes a huge difference. That is when I've done DBT, which is called dialectical behavioral therapy. It's a very skills-based type of therapy. And there's DBT adolescent, and then there's DBT children. So I've been trained in all those different things. So I've used it with all ages. And it's used for the most difficult, the most suicidal, like in and out of hospitalizations, aggressive behavior, all the different mental health things. That's what it's for.
Hmm.
And what they did with DBT adolescents is they started including parents in the groups instead of just teaching the teens the skills. It's like you're all going to learn these skills.
Oh,
And
that's so
that
good.
is when they notice the most significant impact, the significant change when and I've done both because our clinic didn't do the parent piece the whole time because I think it was a newer thing that they were starting to find more research on. So the change has happened over time. So I have done both where I have just worked with the teens and then I have worked with teens and parent in the group and definitely the ones with the parents involved who were learning the skills for themselves as well made the
Mhm.
most significant impact and then changed the whole environment in their home.
That's incredible.
Yeah, it is incredible.
Yeah.
And don't get me wrong, like they were tough groups to run because like these
I
are
can't
families that are
imagine.
coming in that have significant tension, hate each other. I mean, really, and now have to sit next to each other in a group with other families that are not doing well. Um, and then to see that like they can barely walk in at the beginning and then by the end be able to see like this relationship take place and be able to reduce, symptoms in the house and to be able to like we like each other maybe now a little bit more, right? Like it's not like a force like, yeah, you're my kid, so I love you, but
Right.
it's like, yeah, we want to spend time together and because it's not constant fighting and it's not constant, so the parents learned how to respond and how to manage their own emotions. And so that's where I would start when you feel like you can't get your kid in
Mhm.
therapy is start with your own like what have you been through your own trauma, how were you parented for yourself, and is that what you want to parent, like is that how you want to parent? Maybe some that's like, yeah, they had great parents, wonderful. A
Mhm.
lot of us didn't have that though, and so
Yeah.
there's most likely things we'd want to change and not do,
Mhm.
but because it was modeled it just naturally comes out whether we want it to or not, and we can want it we can try to will ourselves like I'm not going to do that. I'm never going to do that. But
Yeah.
really what can happen is either we can like overcorrect and
Mhm.
now we're never saying no and now we're never having limits because my parents were too rigid and too strict. So we're just going to do the opposite, which is also not very helpful. Or we do just end up doing what our parents did, whether we like it or not. And so there is still hope and a lot more hope, honestly, because I can tell
Yeah.
which kids are going to be in the longest, dependent on how involved their parents are and how their parents are willing to receive what I have to say and take the feedback and make the changes, because that's when the change is actually happening. If parents are not wanting to do that and they reject it, and then I can tell, like, all right, I'm going to be seeing this kid for a really long time.
Well, I just want to say thank you for what you're doing. Like I like to say like our yeses have generational implications. So I
Yeah,
mean this is just a
they do.
very clear picture of that, your yes having generational implications. Do you have any, I know you probably have to be very confidential, but is there any like people that you would like to share just a testimonial that you had that you work with, without naming any names, that you saw like a massive change, whether it's through,
Yeah. Yeah, and I won't name any
yeah.
names. I do have um quite a few, but one that often sticks out to me the most was I haven't seen her in years now, but I did see her for a few years, I think. And when I started seeing her, she was struggling with suicidal stuff and deep depression and anxiety and all these things. And she was, I think, 19. And I think when she was 15, she was told by probably multiple clinicians, doctors, of like, yeah, you have clinical depression, I think even dysthymia, which is like the long-term depression, and told it to her as if like this is just something you're going to struggle with for your whole life. Yeah. And when she told me that, she basically, by the time she got to me, because she had been in and out of hospitals and other therapists and stuff like that, she had told me that, and I looked at her and I said, that is not true. You do not have to be depressed, and we are going to work on it. If you are willing to work with me, like, and we're going to work on it, this is not true. And sure enough, a few years later, we ended up discharging because she was doing really great.
Oh,
And we had done some trauma stuff because we had to dig into some really hard stuff. I taught
mhm.
her some skills of like how to manage things. And I think even in during that time, I think she had a suicide attempt.
Mm,
Um, and so there were some tough times in that, but she did stick with it. And in doing so, then made a huge, where I was like, she's like, I don't know if I have depression, and I was like, I know, because it's not your identity. Yeah,
yeah,
it's not who you are. And we do not just, I was like, by that time, I was like, you're like 21. Like,
yeah.
I am
Right.
not going to just accept that you are just going to be depressed your whole life. But a
No.
lot of people, that is, I mean, there are therapists who will see people forever because it's easy. You get paid, you have guaranteed client, and therapists just want to validate, and they're, it's like, okay, I'm
Mm.
not that person. Like,
Yeah. So
I
I was
want
going to
you off
say
my caseload. Yeah.
you're
So
like, I really don't want to see you long
I
term.
don't want to see, I want to work myself out of the job. And I would tell them that, especially as
Mhm.
it would get closer to discharge, where I'm like, you're doing well. Like, I know that this is like, it's hard in that, like, you work with this person, for years in some
Yeah.
cases, and they know, I know their deepest, darkest fears
Right.
and secrets and all these things, and we work through it, and then now we got to be done, and then we're just done. And
Yeah.
so it is this really weird, relationship,
Really.
but I do tell them, like, my job is to work myself out of the job.
Hmm.
It is never to keep you here, and I'm not a therapist that is just okay with seeing you just to see you and
Yeah.
keeping you in a place of basically not being healed, just so
Yeah.
that you can have a therapist, or so that I can have a paycheck, or whatever that needs to look like. So yeah.
Mm.
So I've had multiple like that. I mean, I had another one where we did some EMDR, and I mean, she had been raped, and years later still couldn't even go to the city, couldn't even go, like, just pretty significant PTSD. We did some
Mm.
EMDR, and then she had no symptoms after that. So she could go to this, she could think about it, and just, like, it happens. It doesn't erase what happens, but it changes the physiological symptoms and how we feel about it. And we don't have to keep experiencing it over and over and over every time you've been triggered or think about it, or something like
Mm.
that.
Wow.
And she was like, I think I remember her being like, maybe I just got a good night's sleep because it happened. It changed. EMDR changes the brain and how the
Yeah.
brain is able to it heals it
Okay.
essentially. And so she was like, maybe I just got some good sleep. I was like, okay, look.
So she thought she had good sleep the night.
Yes, I was like, look, okay, you have not been in that city
Yeah.
like years and couldn't go past a certain spot and you couldn't think about it. Like, that's not true. And I was
Yeah.
like, but I get that, like, it feels normal now to because you're not experiencing that. And so to help someone work through these all like significant, difficult, life-changing things to now like you don't have to live in that bondage anymore.
Right.
And they so many people don't have people telling them that. Like it is just kind of
Yeah.
normalized a little bit. And well, you have anxiety, you have depression, take this
It's like
medication
a
and
word curse
yeah.
in a way, isn't
Yeah.
it?
And then people just kind of
Genetic.
accept it like, oh well, and I I'm the professional, so I hold weight in the things that I say, and other professionals in this field hold weight and unfortunately misuse it.
Mhm.
And not all therapists are Christian,
Right.
so
Right.
they're not viewing it from a lens of like, no, you can be healed
Right.
and whole again and restored, and they're not viewing it from that either. It can just kind of be like, yeah, you've been through a lot, so this is this is kind of
Been
it,
through
or
a
this
lot in
you
life.
have this, you have that, and these are like genetics, and like like
Yeah.
I question a lot of genetic
Hmm.
diagnoses because it's like genetic or trauma and environment and
Hmm.
like what like and can we change? I'm going to change as much as we can. Like I can't change your genetics, but I'm
Right.
willing to bet that I could change a lot of the things that you're experiencing
Wow.
because I don't totally agree that it's just genetic.
Yeah. Well, I love your heart, just the way
Yeah.
that you operate in this way. There was one thing that you mentioned, like the EMDR, for those who don't
Mhm.
know what that is. Is there a way for you to just share a little bit about, what that might look like?
Yeah.
And then also just kind of bearing, into like if somebody lives, we're in Minnesota, if somebody lives in another state and they're like, well, I wonder how I could find a really good Christian therapist, like how could
Yeah.
they do that?
Yeah. So, um, start with EMDR first is stands for eye movement and desensitization and reprocessing. It's a
Mhm.
crazy long name,
Big
that's why it's shortened. And it's international, like that is also evidence-based, research-based, and they started it by working with war veterans years ago. Francine Shapiro, I believe. And so she started to discover that like progress was happening in like 1 to 3 sessions versus a year of like talk therapy. And
That's
so
amazing.
because it's bringing in the body and it's bringing in other pieces and your brain's kind of pulling up images like a lot at once, you're not verbalizing all of that. And
Mhm.
so you are processing and rewiring because it's lighting up the neural network in your brain, you're rewiring it
Mhm.
essentially. And so now it's very intense because it does feel like you're feeling the trauma again in a way. And so people have like thrown up, thankfully not in my office. Like I don't know how I would do that. However, one time she got close because we uncovered that she was sexually abused and she didn't remember. And so she was in her 30s, late 30s. That was another actually huge story of she's like, I can't really remember my childhood. I'm like, you're like late 30s, early 40, like you should remember your childhood. Like, so that was a red flag. And we started doing all I started with, I felt like the Holy Spirit was like, ask her if she remembers the house. And she did. She's like, I think I have a maybe like suspect something happened. And I was like, well, do you remember the house? And she could remember looking out a window or something. That
Mhm.
was it. I
But
had nothing else and I needed more. I should have had like like there's things that I needed to have for EMDR and I
yeah.
didn't. And so I literally just kind of followed the Lord in that and was like, we're just going to start there and just go with it. And in that session, she had a full-on panic attack because it was like it unlocked really just horrific things,
Mhm.
but it was killing her body. So she was kept going to the doctor and her throat had been closing up, like just these things that were causing issues and she can't figure out why. And we start doing some of this stuff and her
Yeah.
throat was opening up and she was losing weight. She's like, I've eaten well, but she was very overweight.
Oh,
And she's like, I've counted calories, I've done all of these things, like diets, like it doesn't matter, like, but like doing EMDR, like working through the trauma was literally in front of me, changing each week, changing how her body looked and how she was able to experience and experience the world and stuff. And so that was a huge, I've had many moments like that where the Holy Spirit is like, ask this, start here, because I don't
right.
know. And
Right. You're like, I don't
I'm
have
really kind of
all I
guessing.
need
And a lot of
here.
the time they don't know. They're just like,
Right.
yeah, I feel like I
Yeah.
have these symptoms, but I so love getting to the root of it. And so EMDR is just one method. That's not, doesn't have to be the method, but it's one
Mhm.
of them that it's a pretty intensive. And she went through some really intense sessions. One session, she was just experiencing physical symptoms. So it wasn't even really memories, but I was like, we got to allow your body to feel this because trauma is stored in the body. And so
Mhm.
we have to allow it to work its way through.
Mhm.
And that made, some huge change. But those are weird sessions. Like that it's just like,
Sure. Yeah.
wow, is this
Like,
this working? But she would come back and just be like, this has happened. And like maybe some things would come up because we can keep reprocessing. But it was incredible, just some of the,
oh,
and then that impacted how she's shown up as a mom and a wife and being able to work and operate. And so that changed their whole family system because she did
amazing.
the work. And so it really has this ripple effect.
Generational.
Yes, it is
Really.
generational. And then now you're passing on like the importance of working on our emotions. Now you're able to validate. Now you're
Mhm.
able to kind of hold that space because she couldn't. She had no window of tolerance to hold anything extra, but then had these kids who have special needs that have extra, a lot of extra things. And so she was just fried and burned out isn't even the term of like to where she was at. And so I worked with them for a long time on like I worked with the kids and I worked with her for a lot of years. And so when I had to leave my clinic, that was a tough relationship to end because she's like, I mean, I've helped with significant life changing, but really it's the Lord who just guides these
Yeah.
processes to help us
Mhm.
to get through it. So um, but she's one that it's just like, yeah, because healing can exist and you have been through horrific,
Mhm.
horrific things.
Mhm.
And we can still be healed and don't have to have that define you. So, so EMDR is in you can actually go on their EMDRIA website, EMDRIA, I think .org or something, and go
Okay.
and you can search for an EMDR therapist because they can be certified EMDR therapist, and you can find a list in your state
Oh,
because it is an international organization because it's pretty big and stuff.
okay.
So so you can do that. There's other you can look up Christian EMDR. I mean, a lot of therapists can be on like Psychology Today and whatnot. And you can search for specific ones.
Okay.
Will have the credentials and may say that they're faith-based and include spirituality. So that's kind of something you would want to look for if you're looking for a therapist and ask them that. Therapist is really important. Like that's an important job. And if you don't fit
Mm.
well, that's okay to like move on.
Yeah,
Yeah,
it's
like
right.
we can say no, thank you. And I've had that. I've had a few different therapists. Now I have one that I just go back to when I need to, whether that's a tune-up or I've had something, new come up,
Yeah.
who I love her. And because my sessions have often include a lot of spiritual processing and beliefs and I've seen, just a lot of different things involved that I needed a Christian.
Yeah.
So that is important. So sometimes
Mhm.
you can find, Christian clinics
Mhm.
and you can just look up their bios and see like what is their credentialing, do they say that they're trained in EMDR? Do
Mhm.
they, what do they say that they're trained in?
Mhm.
Does matter. And then yeah, do you click with them? Do you feel comfortable and safe? Because the space is going to really matter. If you don't feel comfortable, you're not going to dive deep into your deepest stuff,
Right.
you know?
That's so true. That's
Yeah.
such a key for people to
Yeah.
take it. I want to make sure that we cover for sure, like what does the Lord have you doing today? Like where are you at now? What's going on in your season?
Yeah, it's a different season. It's a different season. So, I am now have started a couple different things. So, one is called Refine by Fire, which is a consulting business because I have taken my skill set into like the workplace a little bit. So, I've worked with a childcare center in the area that my
Mm.
kids were we used to go to and ended up I don't know. I don't really know how it happened, but ended up getting involved in they hired me just some staff dynamics. And so I really enjoyed it, like being able to meet with people. It's very similar to therapy in that it's figuring out what's the root of the problem here, like what's causing the chaos, what's causing the conflict, how can we get to it and fix it and resolve it, how can we use skills. And so it ended up saving people from quitting their job. It so now those people are leading the center and stuff. And so I actually see them again tomorrow and I've gone back just for some extra stuff that but it's not as bad. Like it was on fire essentially. It was a dumpster fire and now it's a lot better and then teaching them just more like organizational structure and just how do we handle things differently so to change the
Yeah.
system, which is what
Yeah.
I really love. I love changing systems because I
There
know
you
that
go.
it can impact
Yeah.
more people. And so
Yeah.
if I can start with the leadership at the top, the director and the manager and the owner, people
Yep.
doing these things and they make changes and know how to set boundaries and know how to validate their staff and know how to do these things, like you're going to have happier staff, you're going to have less conflict, there's going to be less triangulation and gossip and all these other things that kind of can really ruin the organization. And so I've really enjoyed that. So Refine by Fire
Amazing.
was started there, yes, with that.
Can I ask you a question about that really quick?
Yeah, yeah.
Now, is that something that you can just do in person, or is that something you do virtually?
Both. I could do both. Right now,
Mhm.
they're close, so I go see them in person and meet with them. But
Okay.
it could be both. Yeah,
Okay.
where it's just taking my skill set, like it is therapy on a different level, where we're not diving into trauma,
Yeah.
but I am teaching skills, and it's people. As long as you're working with people, like
Yeah. You're like,
you're gonna have some dynamics, you're gonna have
yeah.
some things going on and we don't realize how much the workplace actually brings up our family stuff and our family dynamics and it brings out our family role. Am I the oldest? Am I the youngest? Like that stuff starts to come into our
Interesting.
workplace and we just don't realize it. We just do it. And
Yeah.
so that's the stuff that I like to address and bring to like mind of like, I
Yeah.
wonder if, this is happening because of this, because now I've been meeting with them and it's like a fun puzzle to me. I'm just
Oh,
like,
I love
"Oh, I
that.
bet that this is like how it works. And then they're like, yes, like that totally makes sense. Like to help them come to the insight because it's so
Mhm.
powerful. And then they're like, oh, then I'm gonna stop doing that, or I'm gonna work on this because they
Great.
just didn't know.
They recognize it and then they
Yeah.
run with it. Yeah.
Yes, yeah.
Amazing.
So,
I love
which is
that.
kind of like I have to ask certain questions, or why do you think that would be, or
Yeah.
which is really the Holy Spirit just helps me navigate that. But it's fun to
Mhm.
just be like, wow, like, oh, I never thought of it that way, or
Right.
that makes total sense, or
Questions
yeah,
are
yeah,
amazing,
yeah,
aren't they? They
hmm
really
yeah.
are.
You make
And
it make
rather than you saying, do this, and you're,
right.
or
If
you have
I
to,
have the insight, it's just not as it just doesn't matter as much,
yeah,
right? Because it's me, but something about when there is a difference when they have it
like,
that I can just see it in their face and their demeanor of just like they're just like blown away. I'm like, I know, isn't that
right?
like so
You're
cool?
like, work,
Yeah.
work is done.
Yes. Yes. It's
Awesome.
fun
So,
to watch.
and then you have another avenue that you
Yes. So
have.
then I started a nonprofit called Embers of Hope. And
I
that
love the name, of
Has
course.
to, yes, yes. Refined by fire is from Isaiah 48:10.
Yeah.
How we are, yes, we're refined through our affliction and through our suffering. And that has been so much of my life and so
Yeah.
much of other people's life. So on my Refined by Fire website, I actually started some merchandise and things like for
Oh,
people
yeah.
to buy sweatshirts or t-shirts or
Oh,
whatever, because,
cool. Okay.
have the Bible verse
The
on it and
website.
stuff. But
We'll capture that quick if somebody's like, "What's the website?"
yes, yes, because and I can say because I have two, so I can make sure you
Yeah.
have both. But that's that one, and then Embers of Hope kind of branched from that into how can I work with survivors of trafficking, and so this is where it's another pivot in my life of like hard left again. Like this is like what we're doing.
You're definitely a
Um,
pioneer.
yeah, I know. I've noticed that it seems
Yeah.
like. And so, this was, I mean, honestly, I actually wanted to work with survivors, since, I don't know, 10 years ago, maybe, but just never really knew how to get into that. So this happened a couple years ago when I went on the missions trip to Montana and started asking them questions about mental health and just discovering how they were significantly lacking the help and the long-term restoration side of it. So a lot of what's happening now, because I've spoken with multiple different organizations to try to see like, okay, is this just the one experience? Like, is this happening universally? And I know I can't, like, I haven't spoken to all of them, but I
Mhm.
have still at least talked to quite a few. And a lot of what's happening is the rescuing and
Mhm.
trying to get the crisis intervention happening of like how do we get housing and food and safety and all those things that are
Like the
definitely
basic
needed.
necessities.
Yes.
Mhm.
But a lot of places, cap it at maybe 90 days or maybe six, like they're just short term. And then you have more people coming in, you got to get them out. Like, how do we just get them a job and how do we get them moving on? Well, when I heard the statistic that on average they return to their trafficker 7 times, I was like, we are not taking care of them long term.
7 times.
7 times. Yeah. Yeah. So it's astonishing. And that's what, like, I learned it on the missions trip. They had shared that. And I was saying like, I know why. Like, because they're not being taught skills. They're not having long-term care because this level of trauma is not treated in 3 months, 6 months, even a year. Like this is long term that you need someone, but these places can't keep them for that long. And so they're really just trying to get them out and move on. Well, that's very hard to do. So because you can't just overcome the trauma and the PTSD symptoms and all the
Right.
things and the physical symptoms that they've experienced, just all the stuff. So so my nonprofit is to work for like help that. So I've contracted with multiple different clinics and therapists, one who are Christian and like just sound theology in that, and two are well trained in trauma intensive like interventions, so they know what they're doing because not every therapist is trained in the same thing. We all can have an LPCC license, but we did not all get that through the same training. So and there's so much that you really could just like pick and choose. So not all therapists know how to do trauma. But organizations don't necessarily know that. You just hire someone who has the
Right.
license behind their name, and it
Jeez.
doesn't always go great. And that's what I witnessed at this safe house. They had the turnover, they had therapy. "I can't do this." Yeah, because you guys are not trained well. You should not be doing it. And now you've caused more harm because now you've up and left and just like everybody else in these women's lives. And so now we've caused harm because of that. And so I don't contract with any therapists. I meet with them. I know most of them. And
Yeah.
I make sure that they're actually a good fit. And so then they can fill out, a person could fill out our quick form online,
Mhm.
and then we can pair them with a therapist, one who would actually could stay with them if they transitioned, if they moved, if at least in Minnesota for right now.
Okay.
And then they would be able to, have care longer than maybe what their housing or their organization or safe house or whatever is allowing them to have. So,
Mhm.
and then we could actually get to some deeper
Yeah.
rooted stuff. So right now we can take the referrals of women who have insurance. Usually they have state insurance. The goal is to eventually get funded so we could pay for like women who aren't insured so that that's not a barrier to their treatment
Okay.
either, because that can be, obviously therapy would be way too
Sure.
expensive for anyone to be able to pay for most people, much less someone who's coming from that
Right.
world. So
Okay.
so
Well, that's
that is that side of it. Yeah.
Wow. Well, I'm just as I'm listening, is there, if somebody's listening in, either now or, later down the road, like how could somebody come alongside and help you in this, especially in this aspect of, is there anything that, is there any asks that you want to put out there for somebody
You
who's
know,
listening?
couple like just creating awareness for one can be really helpful. And not a lot of people know really about the long-term side of things. So to be able to build on that of like, hey, we can't just rescue them. Like we have to invest in the long-term restoration. So awareness is really helpful. Funding is super important to be able to fund this. It's expensive to um be able to pay for someone. That's why we can really only do ones that have insurance, but that's limited because they don't all typically have insurance and
Right.
I'm trying to do more networking with if you know of organizations that would like, hey, they work with because then we can partner with other
Yeah, it's like
organizations.
a network.
Yes, how can we network and connect? So how can we serve you? You guys maybe do the 6 months, but like, can we take it from there after that? And so if people know of like, hey, this could be a great organization, at least right now in Minnesota.
Mhm.
Eventually it'd be great, yes, to expand, but it's definitely in Minnesota for now. But that can be really helpful as the networking piece as well.
Mhm.
So yeah, those would be the top few I would say.
Okay. Well, thank you so much for everything you've shared today. Like this
Yeah.
has been so incredible. I feel like we'll have to have you back. And have you written a book yet?
No, no, but thank you for thinking that I could. Like,
Yeah.
yes.
Oh
So
my,
that's
got
true.
a lot.
I could.
You have a
Thank
lot of
you.
goodness in you. Well, as we close today, I just want you to just take a moment if you have any other words of wisdom or encouragement that you'd want to speak over the one, because I really do this for the one who's listening. I'll let you just take a minute to share that over that one who's listening.
I would say that sometimes it can feel like you've been through so much that there's just no way that you could really get out of it. And the
Mm,
mountain may feel really overwhelming and so it's it's not easy, but it feels easier to stay in the yuck. Um, but I recommend still seeking help. And help can look like it can look like therapy, it can look
mm,
like a book, it can like
mm,
Christine Kane has good like it can just look like resources, like starting there, but really look at it from a bite-size portion. Don't look at the whole mountain. Just look
mm,
at the next step and eventually you're going to be up over the mountain. Like it's going to take time, but if we look at all of it all at once, it will be way too overwhelming. And that paralyzes us in this state of just like, I can't do it. There's no way. There's been too much. And it's just not true. And our society wants to tell you, and try to keep you in that place,
mm,
and we don't have to live there. And God doesn't want us to live there. He wants us to move, and he also doesn't ask us to heal everything at once. Like he doesn't ask a lot of us. Like it really is just the next step. Like it is an onion that you're peeling back, and that could be years, and that feels overwhelming, but you're not in the same place for those years. You're moving. We
yeah.
do move forward, and then eventually you look back and then you're like, wow, because if in a year from now, if you are taking steps, you will at least moved versus being in the same place a year from now, because it's still going to happen. A year is going to happen, and you kind of get to decide how you want that to go. Like you do have a say, you do get a choice, even though it is
Mhm.
a very, very hard choice. But we don't have to stay there. There is hope and healing.
Yes, there's hope, and you don't have to stay there. I love it.
Yeah.
Beautiful. Well, thank you for being a brave voice who's setting so many
Thank
free.
you.
This is the best way for people to contact you. I'll put
So
everything in the show notes for sure.
okay, yes, yeah. I would say through email. I would say I know I have a couple of them, but let's Refine by Fire. So it's info@refinebyfire.info, and so that goes straight to me. I don't have anyone else helping with that. Like that will go to me. That would be the best form of contact for now. Yeah.
Okay, sounds good. Well, I'm going to close with the Hope Unlocked anchoring verse. It's may the God of hope fill you with all joy and peace in believing, so that by the power of the Holy Spirit you may abound in hope. And that's Romans 15:13. So thank you so much, Mallory, for
Yeah.
coming
Thank
on.
you.
I will be back with another episode next week. Thanks, listeners.